states, including Kerala, Maharashtra, Punjab, Chhattisgarh, and Madhya Pradesh, have been witnessing a spike in daily COVID-19 cases. These 5 states have accounted for roughly 90% of all new cases detected in the last 5 days. Haryana, Karnataka, and Rajasthan are next on this list. In fact, in the last week, 16 states and union territories have registered a spike in daily cases. This has triggered fears of a second wave of COVID-19 in the country. Karnataka, where clusters of cases have been identified, has made it mandatory for people traveling from Kerala and Maharashtra to carry negative RT-PCR reports. While the health minister of the state has denied the possibility of a lockdown, Bengaluru Civic Agency has said that it is entirely dependent on people's behavior. Tamil Nadu has also amped up surveillance and now needs a negative RT-PCR test for anyone flying into the state from Kerala. Maharashtra's Chief Minister Uddhav Thackeray has given people a window of 8 days to go back to wearing a mask and socially distancing, or else he'll declare a lockdown. Active cases in the state have jumped from 40,000 to 53,000, as high as in October 2020, and so religious, social, and political gatherings have been banned once again. In Mumbai, buildings with more than 5 COVID-19 patients will be sealed by the BMC, while marshals will roam the state, enforcing mask wearing and social distancing at public places. Stamps on the hands for patients staying in home quarantine is also back. In Madhya Pradesh's Balaghat, night curfew has been declared as a preventative measure since it borders Maharashtra. Punjab, with a lower daily new case count, has the third highest number of deaths in the country, but its cases are also rising. The government has chalked up this surge to laxity in following COVID-19 protocol, while realizing that it is not vaccinating as fast as it would like. So far, only 79,000 of 2.06 lakh healthcare workers and 4,000 of 1.82 lakh frontline workers have been administered the vaccine in Punjab. The Chief Minister of Punjab has issued a strict warning. Healthcare workers who do not get vaccinated despite repeated opportunities will have to bear the cost of their treatment in case they get infected later. They will also not be allowed to avail quarantine or isolation leave. In Rajasthan, not more than 100 people are now allowed to attend an event, including weddings. The Jodhpur police has issued a diktat allowing only essential services, schools, and colleges to function. Section 144 has also been imposed in the city till March 21st. Now, these restrictions across the country are in addition to new guidelines imposed by the center for international travelers coming into the country via air bubble agreements with other nations. All international travelers now have to submit a self-declaration for COVID on the online Air Suvidha portal before their scheduled flight. They will also need a negative RT-PCR report conducted within 72 hours prior to the journey, along with a declaration on the authenticity of the report. Airlines will identify international travelers arriving from or transiting through the United Kingdom, Brazil, and South Africa. These are the 3 countries where worrying mutations of the virus have been spotted. On the vaccination front, India enters the next phase of inoculation in the first week of March. About 27 crore beneficiaries of ages 50 years and older will be eligible to receive the vaccine, and those above 60 with comorbidities will be prioritized. Indian Express reports that the next phase will have 2 groups: those who will get the vaccine for free and those who will have to pay. We should know more about who gets it for free and who will have to bear the expenses soon, and I will keep you updated. But as I mentioned earlier in this video briefly and my last COVID-19 update, vaccine hesitancy remains considerably high in the country. About 35% of healthcare workers across India have either declined, fail to turn up or not receive their first shots of a vaccine as on Saturday. And the number of people returning for their second doses on time is even lower. A total of 1.17 crore people have received either one or two shots till now, which means India has vaccinated only 0.8% of its population. Experts say that till we don't have sufficient vaccination coverage, which by some estimates extends into 2022, we simply cannot afford to lower our guards. They reiterate a list which we should have memorized by now. Don't go out till you absolutely have to. Parties, weddings, night outs must wait. Avoid large groups, wear a mask, if even two if you can. Wash your hands and don't touch your face. And if the pandemic seems less urgent or less deadly thanks to a few good weeks we just had, just look to America. Today, it crossed the heartbreaking milestone of 500,000 deaths to the virus in 1 year. Before I go, Bharat Biotech has announced that it will release Covaxin's efficacy data in 2 weeks, and I will keep you posted on that. My name is Pallavi Prasad, and if you have been listening, thank you so much for your time.